Okay, so masuk 4.3.1 vibration. So definition of vibration refer to movement of solids where the amplitude and frequency produced may cause harmful to those exposed. Okay, may cause harmful to those exposed. Okay, vibrating object. Kalau kita ada kat sini, kita ada vibrating object macam penukul ke apa. Lepas tu kita ada ni semua. Okay. Okay, to types of vibration in context of workers' health. So whole body vibration, where the vibration usually transfer when in contact with the feet or buttocks. Okay, so contoh buttocks ni lah punggung lah. So vehicles operation and then heavy vehicles. Okay, hand arm vibration, where the vibration usually transfer when in contact with the hand due to use of vibrating equipment. Contoh hand drill, chainsaw dan etc. Okay. So health effect: whole body vibration, blurring eye, nausea, vomiting, headache, back pain. Okay, that can cause lung and heart malfunction. Okay, ini dari segi health effect bagi whole body vibration. Okay, mungkin boleh pening apa kan. Okay, so hand arm vibration. So health effect dia damage blood vessel, nerve and musculoskeletal system, pale finger, numbness and pain, and then ada carpal tunnel syndrome. Okay, so prevention and monitoring control yang boleh dilakukan adalah evaluation risk prior to purchasing and vibrating equipment. Okay, contoh kalau macam kat vehicle, kenderaan, kita boleh pakai tempat duduk yang maknanya yang ada span semua kan. So untuk mengelakkan daripada gegaran. So eliminate hazard. Okay, and then substitute with less vibrating equipment. For example, anti-vibration. Kan, reduce exposure and then lakukan training, information and instruction. And then lakukan juga periodical maintenance equipment. Okay. So heat stress, masuk kepada heat stress. So interaction, heat stress occurs when the body's means of controlling its internal temperature starts to fail. Okay, as well as air temperature. Factors such as work rate, humidity and clothing worn while working may lead to heat stress. Okay, dalam keadaan panas lah So workers who are exposed to extreme heat or work in hot environments may be at risk of heat stress. Exposure to extreme heat can result in occupational illnesses and injuries. So compilation of severe heat stress in body. Kita boleh tengok the heat stroke, exhaustion, heat exhaustion, heat syncope, heat cramp, ada heat rash, merah-merahan. So the heat equation. So kita boleh tengok kat sini. So kita ada high temperature plus high humidity plus physical work equal to heat illness. Ni ada equation dia. So high temperature, high humidity, okay, physical work yang tinggi. So ada sama dengan heat illness. So when the body is unable to cool itself through sweating, serious heat illnesses may occur. The more severe heat-induced illnesses are heat exhaustion and heat stroke. So if left untreated, heat exhaustion could progress to heat stroke and possible death. Right? Okay, so ni relative humidity. Humidity tinggi, temperature tinggi. Okay, boleh buat heat stress. Okay. Okay, heat stroke occurs when the body becomes unable to control its temperature. So the body's temperature rises rapidly, the sweating mechanism fails and the body is unable to cool down. So can cause death. Tengok ni macam ni. Okay, so symptom dia hot, dry skin or profuse sweating, hallucination, chills, throbbing, headache, high body temperature, confusion or dizziness, and then slurred speech. Okay, so cara dia macam mana? Okay, kena apply cold compress. Ini dekat bahagian lehernya. Then have the person lie down, baringkan dulu, letakkan cold compress, okay, maknanya ambil tuala basah kan, and then give fluid, bagi air. Okay, use a fan to lower temperature, and then elevate feet, naikkan sikit kaki dia. Alright, ni cara untuk kalau dah terkena heat stress ni, cara nak bagi first aid lah. So heat exhaustion. Heat exhaustion is the body's response to an excessive loss of the water and salt, usually through excessive sweating. Ni mana banyak peluh lah ni. So symptom dia heavy sweating, extreme weakness or fatigue, dizziness and confusion, nausea, okay, clammy, moist skin, pale or flush complexion, muscle cramps, slightly elevated body temperature, fast and shallow breathing. So first aider, have them rest in a cool, shaded or a conditioned area. So have them drink plenty of water or other cool, non-alcoholic beverages. So have them take a cool shower, bath or sponge bath. Okay. Kenapa kena ambil non-alcoholic? Sebab alkohol dia panas. Sekarang tambah panas lagi. So heat syncope is a fainting or dizziness, usually occurs with prolonged standing or sudden rising from a sitting or lying position. Okay, factors that may contribute to heat syncope include dehydration or lack of acclimatization. Okay, acclimatization. Okay, maknanya berada di tempat panas lah. Berdiri di bawah cahaya matahari. Okay, symptom lightheadedness, dizziness and fainting. So first aid, sit or lie down in a cool place when they begin to feel symptoms, and then slowly drink water, okay, clear juice or a sport beverages. Okay. So ada heat cramp. Okay, heat cramp ni menyebabkan ni muscle pain. So first aid dia samalah. Okay, stop all activity, sit down, cool place, and then bagilah minum. Okay, do not return to strenuous work for a few hours after the cramp subside, because further exertion may lead to heat exhaustion or heat stroke semula. So seek medical attention if the worker has heart problems. So the workers is on a low sodium diet, the cramps do not subside within 1 hour. Okay. So heat rash is a skin irritation. So berlaku disebabkan ada sweating during hot and then humid weather. Okay, symptom heat rash look like a red cluster of pimples or small blisters. Okay, so cara dia apa? Okay, and then dia kata ni it most likely to occur on the neck. Okay, biasa kat leher, upper chest, in the groin, so under the breast and the elbow. Okay, creases. So first aider, try to work in a cooler and then less humid environment when possible. So biasa kalau yang dah memang bahagian pertukangan contohnya, kan, pertukangan yang buat apa, main tempat-tempat yang memang menghasilkan haba, contoh orang buat gelas, orang buat apa, mana-mana yang melebur okay, metal yang dileburkan, okay, besi yang dileburkan, so memang benda tu panas lah. So kalau nak buat aircon, dia akan ada dia punya, dia panggil air curtain dia sendiri. So and then reducing the risk, so control temperature, provide mechanical aid, regulate the length of exposure to hot environments, and then prevent dehydration, bagi air. Okay, minum air banyak lah. Maknanya bagi tahu pada pekerja jangan lupa minum air. Ataupun kita sebagai, kalau kita jadi majikan, kita sediakan lah. Ataupun kita sendiri kalau pekerja bawa air. So provide personal protective equipment, providing training for your workers, allow workers to acclimatize to their environment and identify which workers are acclimatized or assessed as fit to work in hot condition. Okay, siapa-siapa yang yang tak boleh kerja kat tempat panas, jangan bagi kerja kat tempat panas. So identify employees who are more susceptible to heat stress and then monitor the health of workers at risk. Okay, and then ada heat stress index. So kita ada heat stress index. So ni kita ada ni humidity. Okay, humidity, relative humidity Okay. Ni awak boleh tengok kalau below 80, none. Little or no danger under normal circumstances. So, tengok yang mana merah lah. Tengok merah ni dan yang ke atas ni. Okay, 130 ni. Okay, extreme caution. Ini dah kena berwaspada. Okay, ini indeks dia lah. Berapa persen. Okay. So, heat may be nature's that lies killer. So, kita masuk part yang terakhir untuk biological hazard. Okay, bahaya biological hazard. So, introduction, community and employee awareness. Okay, awareness. Identification of biological agents that cause Legionnaire disease. Okay, hepatitis B and HIV. And then industries such as agriculture, healthcare, biotechnology, research and clinical laboratories. So definitions. Biological agent includes living microorganisms such as viruses and bacteria capable of excreting toxins, exposure to which may cause disease or death in human, animals and plants. So, and then etiological agent. That agent that causes the actual contractions of disease. And infection. Okay, infection is attacks of pathogenic organism on the body which may or may not cause contraction of disease. Okay, biosafety, an area of science that serves to disconnect chains of infection. Agent, what is agent? Physical, radiological, chemical or biological entity that may cause certain effects upon exposure. So host where the agent is present. For example, human, animal or plant. So environment includes living and non-living things. For example, biosphere, atmosphere, okay, lithosphere and hydrosphere. Ini lapisan lapisan dalam atmosfera. Okay, lapisan lapisan ni lah, lapisan kita punya ozon ni. Okay, kita punya ozon tu, okay, dalam ozon tu ada 7 lapisan. Okay, ozon tu ada 7 lapisan. So antaranya ni lah, biosphere, atmosphere, lithosphere and hydrosphere. So interaction between host, agent and environment. Okay, so saling berkait. Tengok. Okay, so agent, carrier, substitute for pathogen, antibiotic resistant, okay, virulent factors, communicability factors, fatal factor. Okay, host, health status, management system, okay, training, health surveillance, use of PPE, perception, reservoir. Okay, reservoir. Okay, environment, population density, medical support facilities, weather, wind or temperature, and then or humidity, and then social, politics, ethnic and facility design. So ini antara interaction okay, yang boleh berlaku. Maknanya host, environment dengan agent ni, okay, boleh berlaku, okay, interaksi. Okay, kalau tak ada environment macam mana kan? Kalau tak ada agent macam mana? Alright. So another factors. Agent must be pathogenic. Okay. Presence of reservoir. Agent must be able to escape from reservoir. The ability of agent to move in the environment. So there is an entry on the new host. So host is susceptible to the agent. Okay, chain of infection. Okay, ni rantangan dia Okay, pathogen masuk dalam takungan, and then pelepasan dari takungan, ada transmisi melalui persekitaran, kemudian tapak kemasukan, kemudian host. Maknanya ni tapak kemasukan ni, okay, dengan host ni contoh boleh masuk dalam 4 bahagian tadi tu. Okay, boleh masuk melalui inhalation, okay, absorption, okay, dan apa tadi, ada guna ni kan, barang. Okay, injection dan satu ingestion. Okay, alright. So control of infection equal to break any connection between chain. Okay, maksudnya kat sini lah. Okay, setakat yang kita boleh lakukan adalah bahagian sini lah yang sekarang ni kan. iaitu pakai PPE. Kan? Inhale, kemudian kita pakai mask kita, kan? Alright? Inilah maksudnya. Okay? Putuskan rantaian. Putuskan rantaian ni, maka tak adalah COVID. Contoh macam tu. Kan? Tapak kemasukan ni kita putuskan. So tak adalah terjangkitnya COVID tu. Okay? Ni contoh dia lah. Alright, so Biological Safety Cabinet Classification. So, dia ada 4 level. Okay. Level 1, low risk. Okay. Level 2, may cause disease on human. Level 3, agent is indigenous. Okay. Contoh macam HIV and TB. Okay. Level 4, agent is dangerous. High exposure may cause risk to life. Okay. Contoh macam virus Ebola. So, sekarang ni ada COVID-19. Alright, tambahlah. Okay. So, control dia macam mana? Kalau COVID, pakai mask. Pakai sanitizer. Inilah So, working safely with biological agents. Biosafety program management. And then, dalam tu, ada identify the scope of programs based on the risk. Develop policy and procedure. Provide training for workers. Supervision and regular refresher course, and they provide suitable facilities. Okay, dari segi administrative controls, apa yang admin boleh buat? So, establish a biosafety committee, appoint biosafety officer BSO, biosafety level 3 and 4. Okay, and then physical containment, based on biosafety level. Okay, dari segi disinfection and sterilization, kena guna use of chemical or physical agent. Okay, and then sterilization kill organisms in total. Okay, sterilize. And then accident, spill and emergency training. Kalau berlaku, and then that one requires specific training. Okay, perlu ada training lah. Supaya tak berlaku lah accident kan. Pertumpahan bahan kimia ke kan. Kemudian transportation of biological agent should be viewed from the perspective of anticipating and preventive accidents, and then compliance with sea and air transport standards. And then biological risk communication. Biological communication strategy should be developed other than workers, should also include the public. Alright, so that's all for chapter 4. Okay, that's all for chapter 4, health hazard. Okay, so dah cover untuk introduction, health hazard. Okay, hygiene ni mungkin kita tak ada lagi, tapi kita akan cover di video yang saya akan tunjukkan selepas ini. So, dalam video tu nanti ada pertambahan. Okay, dia ada chemical, ada physical, ada biological dan ada something new kat situ. So, saya nak awak take note. Alright, so sebab nanti saya nak awak buat tugasan lah. Untuk tugasan. Alright, so kita boleh beralih ke tayangan video Right, sekejap Okay. So, boleh take note ni. So, awak boleh type nanti dekat YouTube Industrial Hygiene Training video. Okay.
Industrial hygiene has been defined as the science and art